if you are one of the millions of people who, suffer from just those debilitating headaches, you know exactly what that desperation feels like.
Oh, absolutely. The sheer desperation is real.
Right. Lying in a dark room, the blinds are completely drawn, and your temples are just throbbing, like right to the rhythm of your heartbeat.
Yeah, and you're just lying there desperately wondering if there is a magic fix somewhere out there.
Exactly. And when a headache ruins your day like that, you realize really quickly that standard medical imaging, so like an X-ray or an MRI, it often comes up completely blank.
Right, which is incredibly frustrating for patients.
It is, because it's a diagnostic landscape that is totally invisible to the naked eye. And for a lot of people, that desperate search for a tangible, a visible fix, it leads to a very specific idea.
Getting your neck cracked by a chiropractor.
Yes.
Getting your neck cracked.
Well, I mean, it is a remarkably common response to a frustrating problem.
Mm-hmm. Because when conventional medicine doesn't offer a clean structural solution, people naturally look for a physical, mechanical intervention.
Right, they want action.
Exactly.
Yeah.
They want to feel something pop back into place.
Which is exactly why today's deep dive is centered on a highly debated question. Is chiropractic spinal manipulation actually effective for treating those headaches?
A very big question.
Huge! And we are pulling our answers from a brand new, incredibly rigorous 2025 systematic review.
Yes.
It was published in the European Journal of Integrative Medicine by a team of researchers, including Luis Ceballos-Laita and Ernst.
And I think it's important to state our goal for today, right off the bat.
Yeah, please do.
Our goal today is to look completely past the marketing hype, past the subjective success stories, all of that, and focus strictly on what the clinical trial data actually says.
Just the hard number.
Right, because this systematic review is a massive synthesis of the best available science up to April 2024. It gives us a really objective lens through which to, evaluate these claims.
So to understand why this research is so critical, I feel like we first have to look at the sheer scale of the headache epidemic, right? Because this isn't just a niche issue.
Oh, not at all.
Yeah.
Not even close.
The review notes that in Europe alone, headaches have a lifetime prevalence of around 53%.
Yeah, over half.
More than half the population will deal with this at some point.
And that staggering public health burden is, well, it's compounded by the fact that not all headaches are the same.
Right.
Broadly speaking, the medical community categorizes them into primary and secondary headaches.
Okay, so let's break that down. Primary is what exactly?
So primary headaches, like your classic migraines and tension-type headaches, those are essentially dysfunctions of the pain-sensitive structures in the head itself.
So the headache itself is the disease.
Exactly. There is no obvious underlying structural cause, like, a tumor or a blunt force injury.
Got it. And then you have secondary headaches.
Right, with cervicogenic headaches being the most diagnosed in that specific category.
And these are fascinating to me because the pain originates in the neck, right? Like maybe from trauma or musculoskeletal issues, maybe arthritic disorders, but you feel it in your head.
Yes, exactly. And the mechanism there is a neurological phenomenon called referred pain.
Referred pain.
Okay. So the upper cervical nerves in your neck, they actually converge with the trigeminal nerve pathway in your brainstem.
Oh, wow.
Yeah. So a stiff joint in your upper spine basically sends a distress signal, but your brain misinterprets the location of the signal, and you feel a piercing pain behind your eye or, wrapping around your skull.
That is wild. So if you go to a standard medical doctor for any of these, whether it's a migraine or a cervicogenic headache, what usually happens?
Well, the guidelines from major organizations like the National Institute for Health and Care Excellence or the VA and Department of Defense, they basically all point you straight to the pharmacy.
Just pills.
Basically, yeah. Pharmacological treatments are the first line of defense. So muscle relaxers, pain blockers, triptans.
And here is where I think we run into the limitations of conventional medicine, right?
Absolutely.
Because medications come with a laundry list of side effects.
Yeah.
Everything from like gastrointestinal issues to severe drowsiness.
Yeah, and furthermore, the data shows that about 1/3 of headache patients are entirely unsatisfied with their pharmacological treatments.
Which I can completely understand. I mean, treating chronic headaches with pills, it can kind of feel like putting a bucket under a leaky roof.
That's a good way to put it.
Right. Like, sure, you're catching the water, but you aren't fixing the hole in the shingles.
Exactly.
People want to go to a chiropractor because it feels like hiring a mechanic to actually fix the structural alignment.
Right. You want someone to get under the hood, find the joint that's causing that referred pain, and physically correct the problem.
Yes. And that desire for, well, non-pharmacological empowerment, that is a massive driver in healthcare today.
It really is. Patients want a treatment where they feel like the root mechanical cause is being addressed,
Right.
not just temporarily masked with an ibuprofen. And because of this, between 8 to 15% of all patients consulting chiropractors in the US and Canada are there specifically for headaches.
Wow.
Yeah. And in Australia, it's even higher. It's 1 in 5.
1 in 5. That is a massive slice of the healthcare market trusting this mechanical theory.
It is.
So we really need to know if the mechanics tools actually hold up under a microscope. How did this 2025 review actually go about testing the effectiveness of the neck crack?
Well, the researchers conducted a systematic review. So they were scouring all the major medical databases. We're talking PubMed, Cochrane Library, Web of Science, Pedro,
Just looking for anything relevant.
looking specifically for randomized controlled trials or RCTs.
Right, the gold standard.
Exactly. These trials are the gold standard for clinical evidence because they isolate the exact variable you want to test. And they searched from the inception of these databases all the way up to April 2024.
But, and this is the crazy part to me, despite searching through literally decades of literature, they only found 8 randomized controlled trials that actually fit their strict criteria.
Only 8.
Yeah. Out of all the bold claims made about chiropractic care for headaches, there are only 8 rigorous trials that strictly tested chiropractic spinal manipulation against a control group for these specific headache types.
It's a very small pool of high-quality data. Let's look at the scope of those 8 trials. Combined, we're only looking at 655 patients in total.
That is not a lot of people.
No. And that was split into 337 people receiving the actual chiropractic manipulation and 318 in various control groups.
Okay. And what were they actually doing to the people in the chiropractic group?
The specific interventions tested were what the industry calls HEVLA, which stands for high velocity, low amplitude adjustments.
Right. So those are the classic quick thrusts you immediately associate with a chiropractor.
Exactly.
The review actually mentions specific trademark techniques like the Gonstead method and the toggle recoil technique. But what is the actual biomechanical theory behind doing that? Like, why do they think a fast thrust cures a headache?
So the theory centers on restoring mobility to a restricted spinal joint. The practitioner identifies a vertebra they believe is misaligned or just not moving correctly.
What chiropractors often call a subluxation, right?
Right, exactly.
Yeah.
So the high-velocity, low-amplitude thrust takes the joint to the absolute end of its natural range of motion and then gives it a tiny rapid push just beyond that point.
And that rapid push, that's what causes the cracking sound.
Yes. That sound is technically called cavitation.
Cavitation. Okay.
See, the joint is encapsulated in fluid. When the joint is suddenly gapped by the thrust, the pressure drops instantly inside, causing dissolved gases in the fluid to form a bubble and pop.
Oh, weird. Okay.
Right. And the chiropractic theory is that this sudden mechanical stretch resets the nervous system reflexes, relieves pressure on the surrounding tissue, and basically breaks that cycle of referred pain that's traveling up to the head.
Okay, so to figure out if that popping and stretching actually stops the pain, the researchers compared the HVLA thrusts against 3 distinct control groups. First, they had a sham group, which is basically a fake chiropractic adjustment.
Yes.
Second, a control group, meaning patients who just continued taking their usual pharmaceutical medications.
Right.
And third, an active physical therapy comparator, specifically deep friction massage and soft tissue therapy.
Exactly. Those were the 3 benchmarks.
Okay, I have to push back on that first one, though, the sham group.
Oh, I figured you might.
I mean, how do you fake a neck crack? If I'm lying on a table, I am absolutely going to know whether or not my neck just sounded like a breaking glow stick.
Yeah, and that strikes at the very heart of why physical therapy trials are incredibly difficult to conduct.
I can imagine.
Blinding a patient, keeping them entirely unaware of whether they are getting the real treatment or the placebo, it's notoriously hard when the intervention is inherently physical and produces a loud noise.
Right, you can give someone a sugar pill that looks exactly like a real pill, but faking an HVLA thrust is a huge methodological hurdle.
It really is.
So what did the practitioners in these trials actually do to the sham group?
Well, they use what they call non-specific contact or low-velocity, low-amplitude pushes.
What does that look like?
So the practitioner goes through the exact same theater of the visit.
Well,
They assess the patient, palpate the spine, position them on the table, place their hands on the specific spinal segments, all of that.
okay.
But instead of delivering that quick, forceful thrust, they apply a light touch or a slow, gentle push that simply doesn't cavitate the joint.
Ah, so the patient gets all the human interaction and the ritual, but none of the biomechanical impact.
Exact.
But surely anyone who has ever been to a chiropractor before would immediately realize they got the fake version.
They almost certainly would, and this introduces a significant potential for bias because expectation plays a massive role in pain relief.
Oh, totally.
So the reviewers had to really account for the fact that patients in the sham groups might have known they weren't getting the real thing.
All right, so we have the 655 people divided up, real adjustments versus fake adjustments, real versus medication, and real versus deep friction massage. When the dust settles and the researchers look at who actually had fewer headaches, what is the story of this data?
Well, the overarching narrative is that the results are highly mixed and frankly very underwhelming.
Really?
Yes, there was so much heterogeneity, meaning the 8 studies were fundamentally different in how they were designed, how long they lasted, and what metrics they tracked.
Okay.
Because of that, the reviewers couldn't even perform a meta-analysis. They couldn't pool all the data into one single, powerful statistical model. They basically had to evaluate them side by side.
I see. Well, let's walk through those comparisons then, starting with chiropractic versus sham, the fake adjustments.
Okay, so 5 studies looked at this, and the results are a bit of a roller coaster.
How so?
A study by Linge on children and adolescents, and a study by Tuchin on adults with migraines. They did find a statistically significant reduction in the number of days the patients suffered from headaches.
Okay, so that sounds like a victory for the chiropractic group, right?
Well, while it sounds like one, the fine print tells a totally different story.
Oh, no.
In that same Tuchin study on migraines, they also measured the intensity of the pain, not just how many days it lasted.
Okay.
And what is fascinating is that the sham group, the people getting the fake light touch adjustment, they actually reported a better improvement in pain intensity than the group getting their joints cracked.
Wait, really? The fake treatment literally reduced the pain more than the real biomechanical intervention?
Yes, according to that data point.
That is wild.
It is. And then you have a study by Chibi that looked at cervicogenic headaches. This one did find a reduction in pain intensity for the real chiropractic group compared to the sham group.
Okay, but let's look closer at that Chibi study, because this is where the data gets absolutely baffling for me.
Yes.
When you dig into the tables, the Chibi study only had 4 patients in the chiropractic group.
Right.
And 4 patients in the sham group. 8 people total.
It's shockingly small.
I mean, that's not a clinical trial, that is a double date. How can the scientific community possibly draw conclusions from a sample size that tiny?
They absolutely shouldn't. And that is exactly the kind of methodological flaw the reviewers are highlighting in this systematic review.
It just seems useless.
Well, in a trial with 4 people, just one person having a naturally good week or experiencing less stress at work completely skews the statistical averages.
Right.
Small sample sizes frequently generate false positive results that just vanish when you try to replicate the study with 100 people.
Okay, so if faking the adjustment is tricky and produces weird results, what happens when you compare chiropractic care to standard medical care?
Yeah.
Did the people getting their necks cracked fare better than those who just went to the pharmacy?
3 studies fell into this bucket. And out of all the variables tracked, only one study, another one by Chibi, this time focusing on migraines, found a statistically significant reduction in the duration of the headache episodes in hours.
So the headaches still happen just as often, they just wrapped up a little quicker?
Correct. Across the board in these medication comparisons, there was no significant difference in the number of days patients had headaches, no difference in the intensity of the pain, and notably, no difference in the amount of rescue medication the patients still had to take.
So the chiropractic intervention didn't get them off their meds?
No, it did not.
Which brings us to the final category.
Yeah.
Chiropractic manipulation versus deep friction massage. Essentially pitting the high-velocity joint cracking against deep muscle rooting.
2 studies tackled this, one by Bove and one by Nilsson, and the results here were utterly flat.
Flat.
The data showed 0 statistically significant differences between chiropractic manipulation and deep friction massage. Not for the duration of the headaches, not for the intensity of the pain, or the patient's medication intake.
Wow. So rubbing the soft tissue of the muscles was exactly as effective or ineffective, depending on how you look at it, as violently thrusting the joints.
That perfectly summarizes the findings. And this is why the review didn't just casually summarize the results. The authors audited the underlying quality of the trials using really rigorous methodological tools.
Like what?
Specifically, the Cochrane Risk of Bias tool and the Pedro scale.
Okay, for those of us who don't design clinical trials for a living, what do tools like Cochrane and Pedro actually look for? Are they just, arbitrary grading systems?
No, they evaluate the structural integrity of the experiment itself. They look for things like allocation concealment,
What's that?
meaning, did the person assigning patients to groups know who was getting the real treatment? Because if they did, they might subconsciously put the healthier-looking patients in the chiropractic group.
Oh, I see.
The tools also check if the assessors who measured the pain outcomes were blinded and if the researchers properly accounted for patients who just dropped out midway through.
Okay, so based on those strict criteria, what was the report card for these 8 trials?
It was highly concerning.
Highly concerning.
Extremely. The review found that 4 of the 8 studies had a high overall risk of bias. This was driven by the lack of proper blinding, poor concealment, and those incredibly tiny sample sizes we mentioned.
Right.
So due to these compounding flaws, the reviewers formally downgraded the overall certainty of the evidence to, quote, very low.
Very low. Wow. So if the scientific evidence is downgraded to very low certainty, and it doesn't firmly prove that it works better than a massage, a fake adjustment, or an ibuprofen, why do so many people swear by it?
That's a great question.
Because we all know someone who insists their chiropractor cured their migraines. And more importantly, if the evidence is weak, is it safe for a listener to just go try it anyway on the off chance they are one of the people it helps?
Well, this raises a vital point about how healing actually operates in a clinical setting.
Okay.
The review emphasizes that sham manual techniques are not inert. Doing a fake adjustment isn't the same as doing nothing.
Because the theater of the visit has its own power.
Exactly. The physical touch of a caring human being, the focused attention of a practitioner who genuinely listens to your symptoms, the ritual of going into a clinic and lying on the treatment table,
Yeah.
and your own internal expectation that you are going to feel better. These are massive contextual factors. They trigger non-specific effects, which we commonly refer to as the placebo effect.
And, a lot of people hear the word placebo and they just think fake healing. But it's an actual physiological response, isn't it?
It is deeply neurological.
Mm-hmm.
When you experience the ritual of care and you expect pain relief, your brain activates descending pain modulation pathways.
Okay.
It actually releases endogenous opioids, your body's natural painkillers, like endorphins, which physically travel down the spinal cord and inhibit the incoming pain signals.
That is amazing.
So the pain relief is very real, but the trigger was the human connection and expectation, not the biomechanical stretching of the joint capsule.
So people are getting off the table feeling better, but they are attributing the relief to the loud pop rather than their own brain's incredible chemistry.
Exactly right.
But what about the safety aspect? Is there a danger in seeking out that placebo effect through neck cracking?
Well, this is where the systematic review issues a really stark warning. Shockingly, out of the 8 clinical trials evaluated, 5 of them completely ignored adverse events.
Wait, what?
Yeah, the researchers just didn't track or report if patients got hurt.
That feels like a massive oversight for any medical trial. How can you recommend a treatment without proving it doesn't cause harm?
It is a persistent and frustrating issue in non-pharmacological studies. Now, of the 3 studies that did bother to track safety, they noted immediate minor issues after the adjustment.
Like what kind of issues?
Things like hot skin, dizziness, local tenderness, and tiredness. And in one trial, the adverse events were notably higher in the chiropractic group. Over 11% of people whose necks were cracked reported tenderness, compared to under 7% in the placebo group.
Okay, but hot skin and a sore neck, that doesn't sound terrifying. I get a sore neck from just sleeping on a bad pillow.
Sure, but those are just the minor transient risks. The review pulls from wider medical literature to warn about major catastrophic risks associated with cervical spine manipulation.
Such as?
We are talking about cervical edema, disc herniation, and vertebral basilar artery dissection.
An artery dissection, meaning literally tearing the blood vessel in the neck.
Yeah, because the anatomy of the neck is delicate. The vertebral arteries thread directly through small holes in the cervical vertebrae.
Oh, jeez.
So when a practitioner applies a high-velocity thrust, violently rotating the neck to the end of its range of motion, that rapid torsion can actually stretch and shear the inner lining of the artery.
That is terrifying.
Blood pools in the tear, forms a clot, and if that clot breaks loose and travels to the brain, it causes a devastating stroke.
Wow. And because of these severe risks, I know the International Federation of Orthopedic Manipulative Physical Therapists, IFOM-OPT, they explicitly discourage the use of spinal manipulation for cervical spine disorders.
They do. They suggest using other conservative approaches, where the patient retains more control over the movement of their own head.
But I do want to play devil's advocate and push back on the statistics for just a moment.
Sure, go ahead.
Looking at the numbers in the review, the estimated rate of cervical arterial disorders following manipulation is somewhere between 2.6 and 2.9 per 100,000.
Correct.
That is an incredibly rare event. I mean, you take risks driving your car to the grocery store. Is the medical community just being overly cautious here?
Well, the statistical probability is definitively low, which is a fair point.
Yeah.
But in medical ethics, we don't just evaluate the frequency of an adverse event, we evaluate the severity of the outcome in relation to the proven benefit.
Right. You are weighing the risk against the reward.
Exactly that. If an experimental surgery is definitively curing a terminal cancer, a patient might gladly accept a 3 in 100,000 chance of a fatal complication because the reward is literally life-saving.
Makes sense.
But as we just spent our time exploring, the proven objective benefits of chiropractic spinal manipulation for headaches are incredibly low. They're supported by very low certainty evidence, and they are largely indistinguishable from a placebo or a massage.
So you have a microscopic chance of a totally devastating, life-altering stroke balanced against a treatment that barely moves the needle in clinical trials and doesn't outperform a basic muscle rub.
Right. The risk-to-benefit ratio becomes incredibly hard to justify. This makes informed consent paramount. A patient seeking relief for a headache needs to be fully aware that the high-velocity procedure they are about to undergo has very low certainty of evidence for actually working, but it carries a non-zero risk of a catastrophic vascular event.
Well, let's synthesize everything we've uncovered today. We started this deep dive trying to figure out if hiring the mechanic to crack your neck is the ultimate fix for your debilitating headaches.
We did.
And based on this 2025 systematic review, the answer heavily leans toward no. The current scientific evidence for chiropractic spinal manipulation treating headaches is of very low certainty.
Very low.
Once you strip away the bias and account for the tiny sample sizes, the neck crack doesn't clearly outperform a fake therapy. It doesn't outperform continuing your regular medication, and it doesn't outperform getting a deep friction massage.
And that last point about massage is highly relevant to you, the listener. If you are one of the millions suffering from cervicogenic headaches, tension headaches, or migraines, and you are desperately trying to avoid taking more medication, this research actually offers a clear, actionable alternative.
Right, you don't have to just suffer in a dark room. You can seek out non-pharmacological help.
The data strongly suggests you might get the exact same level of relief from softer, safer manual therapies, like a targeted deep tissue massage or trigger point therapy. You can seek out the physical touch, the muscle relaxation, and the therapeutic ritual entirely safely.
Without ever exposing your delicate cervical arteries to the rare but catastrophic risks of a high-velocity manipulation. That is a deeply empowering takeaway. But before we wrap up, I want to go back to that one detail that I just can't get out of my head. The Tuchin study on migraines.
Ah, the trial where the sham group showed superior results.
Right. Consider that finding for a second. Patients who received a fake adjustment, where a practitioner just lightly touched their back, went through the motions, and listened to them, they actually reported a better improvement in their pain intensity than the people who got their joints aggressively manipulated.
It's remarkable.
What does that tell us about the human brain and how we experience pain?
Well, it suggests something profound. If the mere ritual of a practitioner's light touch, the focused attention, and the expectation of care can alleviate something as debilitating as a migraine, perhaps the true power of alternative medicine has been misidentified all along.
Like, maybe the healing doesn't lie in the biomechanical cracking of joints and the forceful realignment of bones.
Maybe it lies in the profoundly untapped neurological power of human connection and our own internal capacity to heal when we finally feel like someone is truly listening to our pain.
It turns out you don't always need an MRI, and you might not need a mechanic. Sometimes you just need to feel the hands of someone who is genuinely trying to help.